Assalamu alaikum. Today, I'd like to tell you about a literature review with the title of Management of Amyotrophic Lateral Sclerosis literature review, and this is a literature review that I was a co-author in Karaiova's International Medical Students Conference 2013 in Romania. So I'd like to give you an idea about this literature review. And basically, this literature review talks about ALS. And ALS is a neurodegenerative disorder for the upper motor neurons and the lower motor neurons. Upper and lower motor neurons, and affects the neurons of the brain and the spinal cord and so on. And what's really interesting about ALS is that it was discovered in 1869 by the famous French neurologist Jean-Martin Charcot. But the people really noticed the disease and its importance, in 1939, when the international baseball player Lou Gehrig retired from playing baseball because he was diagnosed with ALS. And this is what's interesting, because ALS actually affects as we said, the upper motor neurons and the lower motor neurons, which later on leads to the decrease in the size or the atrophy in muscles, and this leads to various complications as we mentioned later. So this is ALS. And due to this incidence, actually some people call it the Lou Gehrig disease. Instead of calling it ALS, they call it the Lou Gehrig's disease. So, the next thing that we are going to talk about is the risk factors of ALS. And the risk factors are not clearly established, but we have age. So the older you get, the higher the risk that you can have ALS, or the family history. And from this point, we can define a very important point regarding ALS. We have two types of ALS. We have a familial type, which we refer to as FALS, and a sporadic type, which we refer to as SALS. The familial type accounts for about 10% of the cases, and the sporadic type accounts for 90% of the cases diagnosed with ALS. Familial means that it's due to family history, so that if you have someone in your family who was diagnosed with ALS, then your risk to develop ALS would be higher. Sporadic is not related to family history. And I'd like to mention that in the familial category, about 50% of the cases are genetic mutations. And we'll move to the next point, which is the incidence of ALS, or the epidemiology of the disease. And the epidemiology is, we have 2 cases out of 100,000 people are diagnosed with ALS. 2 out of 100,000 people are diagnosed with ALS worldwide. And accordingly, so it's a very, very rare disease. And we have to mention also that ALS is not contagious. So if you get in contact with someone with ALS, you will not get ALS because it's not contagious. Then, knowing about all of this, we can talk about the diagnosis. So, the diagnosis, for example, we have electromyography, or spinal cord and brain, MRI, and this is quantitative analysis. So in order to check if there's something wrong with the spinal cord or the brain, the neurodegeneration could appear in the MRI or the electromyography. But there's another type, which is the genetic testing. And as we mentioned earlier, that 50% of the 10% of the cases which are familial ALS are actually due to genetic mutations. Well, there have been some genes that are identified to be like risk genes for amyotrophic lateral sclerosis. For example, we have SOD1, TDP 43, or FUS, and there's a couple of other genes that are recently discovered, like C9orf42 and UBQLN2. So these are genes that are actually kind of related to developing or gaining ALS as you proceed throughout your life. So these are means of diagnosis. And we have to know that for ALS, the symptoms as ALS is a neurodegenerative disorder for upper motor neurons and lower motor neurons, the brain, the spinal cord. It can is related to muscle atrophy. So the motion of the patient becomes to be harder and harder, and then if the patient is not diagnosed very early, then this proceeds to more complicated symptoms like hardness to speak or to breathe even, and so on. Finally, the target or the objective of the study was to see the management options for amyotrophic lateral sclerosis. And it was found that just riluzole is the neuroprotective drug. It's just a neuroprotective drug that's used in the management of amyotrophic lateral sclerosis. So it's a neuroprotective drug, not actually counteracting the actions of neurodegeneration, just a neuroprotective. And there are other methods like multidisciplinary care teams, and ventilatory support with tracheostomy, so ventilation in case the patient has or suffers from a hardness to breathe or difficulty to breathe, so ventilation or tracheostomy. And so on. So the final conclusion reached was that there is no actual treatment that targets the neurodegeneration that occurs in amyotrophic lateral sclerosis, and that further research should be granted or warranted in the field of management of ALS. And finally, I'd like to tell you that this website, www.alsa.org, is very, very helpful and informative. And if you visit the website, you'll know more and more about amyotrophic lateral sclerosis. And so that's it for today. I hope it was helpful for you. And until the next time, I thank you for watching and see you.